Hi, I'm Dr. Ryan Westbrook, and today we're talking about something that directly affects over 37 million Americans without them even knowing it. We're discussing kidney disease, but more specifically, we're going to focus on the foods that are silently damaging your kidneys right now. And here's the thing that really matters. Most people don't even realize they're eating kidney-damaging foods until it's too late. Your kidneys are incredible organs. Think of them as your body's filtration system. They clean your blood, remove waste through urine, regulate your blood pressure, produce hormones that make red blood cells, and keep your electrolytes balanced. When you damage your kidneys, you're essentially damaging the filtering capacity of your entire body. And the scary part? Early kidney disease has almost no symptoms. You could be losing kidney function right now and have no idea. But here's the good news. If you understand which foods are damaging your kidneys, you can make different choices starting today. And that's what we're going to do in this video. Let's start with something that might surprise you. Salt. Most Americans eat way too much salt. We're talking about double or triple what our bodies actually need. Now, your kidneys work really hard to regulate sodium levels in your blood. When you eat too much salt, your kidneys have to work overtime. And here's what happens in your body when that occurs. Your blood pressure goes up. Why? Because excess sodium holds onto water, which increases the volume of blood in your vessels. Your kidneys have to pump against this increased pressure, and over time, this damages the tiny blood vessels inside your kidneys called the glomeruli. These are the structures that actually do the filtering. The recommended sodium intake is about 2,300 milligrams per day. But the average American? They're eating 3,400 to 3,600 milligrams daily. That's not a small difference. And if you already have kidney disease or high blood pressure, you should be eating even less, around 1,500 milligrams per day. Where's all this salt coming from? It's not the salt shaker in your kitchen. It's processed foods. Bread, deli meats, canned soups, frozen dinners, snack foods. These are silent salt bombs. Now let's talk about phosphorus. This one is really important if you already have kidney problems, but it matters for everyone. Phosphorus is a mineral that your kidneys help regulate. When your kidneys are working well, they can handle extra phosphorus. But here's what happens when your kidney function declines even slightly. Your phosphorus levels start to build up in your blood. And when phosphorus accumulates, it causes serious problems. It pulls calcium out of your bones, making them weaker. It deposits in your blood vessels, hardening them. It even affects your heart. Where's all this phosphorus coming from? Processed meats are loaded with phosphorus additives. We're talking about deli meats, hot dogs, bacon, sausage, processed chicken products. Colas and dark sodas have phosphoric acid. And here's something most people don't know. The phosphorus in processed foods is more easily absorbed by your body than the phosphorus in whole foods. So you're getting hit twice. You're getting more of it, and your body absorbs more of it. If you have kidney disease, you might need to limit phosphorus to around 1,000 milligrams per day. That's significantly less than what most people consume. Let me talk about something that feels healthy but can actually be problematic for your kidneys: potassium. Now, potassium is essential. It helps your heart beat properly. It helps your muscles contract. It regulates blood pressure. But here's the critical part. When your kidneys aren't working well, they can't get rid of excess potassium. Potassium builds up in your blood. And when potassium levels get too high, you're at risk for dangerous heart rhythms. This is serious. Where's the problem? Bananas, orange juice, tomato-based products, potatoes, spinach, dried fruits, beans, nuts. These are all really nutritious foods in normal quantities. But if you have kidney disease, you have to be careful. A single banana can contain 400 milligrams of potassium. You might need to stay under 2,000 milligrams per day if you have advanced kidney disease. That's not very much. Now here's something that deserves its own section: sugary drinks. Soda, energy drinks, sweet tea, juice. These are incredibly hard on your kidneys. Why? Several reasons. First, the sugar itself. High blood sugar increases inflammation throughout your body, including in your kidneys. It damages the glomeruli, those filtering units we talked about earlier. It accelerates kidney disease if you already have it. Second, sugary drinks often contain phosphoric acid, which we discussed. Third, the high sugar content contributes to obesity and diabetes. And diabetes is the #1 cause of kidney failure in America. But here's what really gets me. The research is so clear on this. Drinking just 1 to 2 sugary drinks per day increases your risk of kidney disease by 20%. That's not a small number. And if you already have diabetes, you're even more vulnerable. The scary thing is that kidney damage from sugar is often silent. You don't feel it happening. Let me talk about alcohol. Now, moderate alcohol consumption might not directly damage your kidneys if they're healthy. But here's the issue. Most people don't drink moderately. They drink heavily. Heavy alcohol consumption increases your blood pressure, which damages your kidneys. It contributes to liver disease, which affects kidney function. It's dehydrating, which stresses your kidneys. And here's something specific. Alcohol impairs your body's ability to regulate water and electrolytes. Your kidneys have to work harder to maintain balance. And then there's the behavior around alcohol. People who drink heavily often have poor nutrition. They don't exercise. They might develop diabetes or high blood pressure. All of these compound the damage to the kidneys. If you have kidney disease, alcohol is generally not recommended. Let's talk about protein because this one is more nuanced. Your body needs protein. That's not in question. But when your kidneys are damaged, they can't process excess protein well. And here's what happens. When your kidneys filter waste products from protein metabolism, they have to work harder when you eat a lot of protein. This increased workload can actually accelerate kidney disease. Now, the typical American diet is loaded with protein, especially animal protein. Red meat, processed meats, dairy products, chicken. These are high in protein, but they're also high in phosphorus and saturated fat, which we've already discussed. If you have kidney disease, you might need to limit protein to around 0.8 grams per kilogram of body weight. For a 70-kilogram person, that's about 56 grams of protein per day. That's much less than the average American diet. Now let's talk about red meat and processed meats specifically, because they deserve special attention. Red meat is high in saturated fat, phosphorus, and potassium. It's also associated with higher blood pressure and higher cholesterol, both of which damage your kidneys. But processed meats are even worse. They contain phosphoric acid additives, sodium, and preservatives. The research shows that regular consumption of processed meat significantly increases your risk of chronic kidney disease. And here's something that really matters. Processed meats are also inflammatory. Inflammation is one of the mechanisms that damages your kidneys. It's like your immune system is constantly attacking your kidney tissue. This is why people who eat a lot of processed meat have higher rates of kidney disease. Dairy products deserve mention here too. Milk, cheese, yogurt, butter. These are high in phosphorus and potassium. If you have kidney disease, you might need to limit dairy products significantly. You might need to use low-phosphorus milk alternatives instead. Regular milk might be fine if your kidneys are healthy and your phosphorus levels are normal. But if you have any kidney disease, you need to be careful. Now let's talk about caffeine. Coffee, tea, energy drinks, colas. Caffeine is a diuretic, meaning it makes your kidneys produce more urine. This puts extra stress on your kidneys, especially if you're not drinking enough water to compensate. In people with hypertension, high caffeine intake can worsen kidney disease. And those energy drinks we mentioned earlier? They combine caffeine with high sugar and sometimes other stimulants. They're particularly problematic. But here's the nuance. Moderate caffeine intake, probably up to 200 milligrams per day, is likely okay for people with healthy kidneys. That's about 1 cup of coffee. But if you have kidney disease or high blood pressure, you should really limit it. Let me talk about something that might surprise you. Whole wheat bread and whole grains. Now, I know this seems counterintuitive. We're always told whole grains are healthier than refined grains. And they are for most people. They're higher in fiber, they have more nutrients. But they're also higher in phosphorus and potassium. For people with kidney disease, whole wheat might actually be problematic. They might need to eat white bread or refined grain bread instead, because the bran and germ, which are so healthy in most contexts, are where the phosphorus and potassium are concentrated. Let's discuss nuts and seeds. Almonds, peanuts, sunflower seeds, pumpkin seeds. These are nutritious powerhouses in normal circumstances. They're high in protein, healthy fats, fiber, but they're also very high in potassium and phosphorus. Just 1 ounce of almonds contains about 200 milligrams of potassium and 140 milligrams of phosphorus. If you have kidney disease, you might need to avoid nuts and seeds almost entirely. Now let's talk about chocolate and cocoa. Yes, even dark chocolate. It's high in potassium and phosphorus. People with kidney disease often need to avoid it. This includes chocolate milk, cocoa powder, and products with cocoa. So if you have kidney disease, that morning hot chocolate might not be a good idea. Let me discuss something that's become increasingly common: energy drinks and supplements. These are often marketed as healthy, but they can be incredibly problematic for your kidneys. Many contain high levels of caffeine, sugar, and stimulants. Some contain herbs that can be toxic to your kidneys in high doses. And here's what really concerns me. People think supplements are automatically safe because they're natural. They're not regulated the same way medications are. Some supplements can directly damage your kidneys. Let's talk about canned foods. The sodium content in canned soups, vegetables, beans, and meats is staggering. A single can of soup can contain 800 to 1,200 milligrams of sodium. That's nearly half of your daily limit in one meal. The problem is that canning requires salt as a preservative, so if you have kidney disease and you're eating a lot of canned foods, you're probably damaging your kidneys without realizing it. Now let's discuss something that's a bit more controversial: high-dose vitamin supplements, vitamin C for example. When you take high-dose vitamin C supplements, your body converts excess vitamin C to oxalate, which is excreted through your kidneys. In people with kidney disease or kidney stones, this can be problematic. Similarly, vitamin D supplementation needs to be monitored because high levels can affect calcium and phosphorus metabolism. And some supplements are directly toxic to your kidneys. Let me talk about something that deserves emphasis: high fructose corn syrup. This is different from regular sugar, though they're both problematic. High fructose corn syrup is metabolized differently than regular sugar. It's more directly associated with kidney disease in the research. And it's in everything: sodas, juice drinks, baked goods, processed foods. You're probably consuming it without realizing it. Now let's discuss fast food and restaurant food more broadly. The sodium content is astronomical. A single fast food meal can contain 2,000 to 3,000 milligrams of sodium. That's your entire daily limit in one meal. The fat content is high, which contributes to high cholesterol and high blood pressure. The sugar content is high. The processed ingredients can include phosphoric acid and other additives. Restaurant food is generally terrible for your kidneys. Let me talk about something personal for many people: sugary breakfast foods. Cereal, toast with jam, pastries, donuts, flavored oatmeal. These are high in sugar and refined carbohydrates. They spike your blood sugar, causing inflammation and damage to your kidneys. They contribute to weight gain and obesity, which increases your risk of kidney disease. And they're often not very filling, so people eat more of them. Now here's something important: alcohol and kidney health. I mentioned this briefly, but it deserves more detail. Heavy alcohol consumption directly damages your kidneys. It also leads to pancreatitis, which can affect your kidneys. It causes liver disease, which affects kidney function. It contributes to high blood pressure, which damages your kidneys. And here's something specific: alcohol is dehydrating. Dehydration stresses your kidneys. Let me talk about NSAIDs, which aren't food, but they're something many people take regularly. Ibuprofen, naproxen, aspirin. These anti-inflammatory medications can damage your kidneys, especially if you take them regularly or if you already have kidney disease. They reduce the blood flow to your kidneys. They increase your risk of acute kidney injury. If you have kidney disease or high blood pressure, you should use acetaminophen instead for pain relief, and you should only use it as directed. Now let's talk about something that's often overlooked: dehydration. This isn't food, but it's related to kidney health. When you're dehydrated, your kidneys have to concentrate urine more, which puts stress on them. It increases your risk of kidney stones. It can precipitate kidney failure in people with marginal kidney function. Most people don't drink enough water. If you have kidney disease, you need to discuss appropriate fluid intake with your doctor, because sometimes restricting fluids is necessary. But in general, most people need to drink more water. Let me emphasize something important: the combination effect. It's not just about one bad food, it's about the pattern. If you're eating processed meats, drinking sodas, eating fast food, eating sugary breakfasts, and having a high-sodium diet overall, you're creating a perfect storm for kidney damage. Each of these things puts stress on your kidneys. Together, they're devastating. Here's what happens in your body. Your kidneys are constantly filtering your blood. They're dealing with excess sodium, excess sugar, excess phosphorus, excess potassium. They're working overtime. Over months and years, this damages the filtering units. Your kidney function declines. Eventually, you might need dialysis or a kidney transplant. And here's what really concerns me. Most people don't know they have kidney disease until it's advanced. Kidney disease is called a silent killer for a reason. You can lose 50% of your kidney function and have no symptoms. You can lose 75% and still feel fine. By the time people have symptoms, they often have advanced kidney disease. Now, I want to make something clear. If your kidneys are healthy and you don't have high blood pressure or diabetes, you can be more flexible. You don't need to restrict potassium and phosphorus the same way someone with kidney disease does. Your kidneys can handle a typical diet. But if you have any risk factors, if you have high blood pressure, if you have diabetes, if you have a family history of kidney disease, you need to be much more careful. So what should you do? First, get your kidney function tested. Ask your doctor for a creatinine test and an eGFR, which estimates your glomerular filtration rate. If you have diabetes or high blood pressure, you should have these tests regularly. Second, if you have any kidney disease, work with a renal dietitian. They can help you understand how to eat in a way that supports your kidney health. Third, reduce your salt intake. This is important for everyone. Fourth, limit processed foods. Fifth, maintain a healthy weight. Sixth, exercise regularly. Seventh, if you have high blood pressure or diabetes, manage it aggressively. And here's something important. Quit smoking if you smoke. Smoking restricts blood flow to your kidneys. It increases your risk of kidney disease significantly. Let me talk about what you should be eating instead. You should be eating whole, unprocessed foods, fresh vegetables, but be mindful of potassium if you have kidney disease. Fresh fruits, but again, mindful of potassium. Whole grains, unless you have kidney disease, in which case you might need refined grains. Lean proteins like chicken and fish, in appropriate portions. Healthy fats like olive oil. You should be drinking water, not sugary drinks. You should be cooking at home so you control the sodium content. If you have kidney disease, you should be focusing on low-potassium vegetables like cabbage, bell peppers, green beans, and cucumbers. You should be eating small portions of protein. You should be choosing low-phosphorus foods. You might need to use salt substitutes that are based on potassium chloride instead of sodium chloride. But check with your doctor first because some of these can increase your potassium levels too much. Here's what I want you to understand. Your kidneys are incredibly important. They're working 24 hours a day to keep you healthy. The food you eat either supports that function or damages it. The good news is that you have control over what you eat. You can make choices that protect your kidneys starting today. If you don't have kidney disease yet, you can prevent it. If you have early kidney disease, you can slow its progression significantly with diet and lifestyle changes. If you have advanced kidney disease, proper diet can help you live longer with better quality of life. So here's my challenge to you. Pick one thing from this video that you're going to change. Just one. Maybe you're going to cut back on salt. Maybe you're going to stop drinking sodas. Maybe you're going to eat less processed meat. Pick one change and commit to it for the next 30 days. See how you feel. Then add another change. Your kidneys are filtering your blood right now. They're working hard to keep you healthy. Give them the support they need with the food you eat. I'm Dr. Ryan Westbrook, and I'll see you in the next video. Please remember, this information is educational and not a substitute for professional medical advice. If you think you might have kidney disease, please see your healthcare provider for proper evaluation and testing. Everyone's health situation is different, and diet recommendations should be individualized based on your specific condition. Thank you for watching.